12 weird signs of liver damage. The liver, a powerhouse organ, tirelessly performs countless essential functions, including filtering toxins from our blood. However, its remarkable ability to regenerate can be hindered by chronic conditions, stemming from viral infections, toxic exposure, or metabolic issues. Liver disease can arise from various causes, and it's essential to understand these factors to promote liver health. Infections pose a significant risk, with parasites and viruses infecting the liver and causing inflammation, ultimately reducing its function. These viruses, such as Hepatitis A, B, and C, can spread through blood, semen, contaminated food, or close contact with an infected person. Another cause stems from abnormalities in the immune system, where certain diseases lead the immune system to attack specific parts of the body, affecting the liver. Autoimmune hepatitis, primary biliary cholangitis, and primary sclerosing cholangitis are examples of autoimmune liver diseases. Genetics also play a role, as an abnormal gene inherited from one or both parents can result in the accumulation of substances in the liver, leading to damage. Genetic liver diseases include hemochromatosis, Wilson's disease, and alpha-1 antitrypsin deficiency. Cancer and other growths can contribute to liver issues, with examples like liver cancer, bile duct cancer, and liver adenoma posing risks. Additionally, common causes of liver disease encompass chronic alcohol abuse, fat accumulation in the liver, non-alcoholic fatty liver disease, certain prescription or over-the-counter medications, and specific herbal compounds. Recognizing these diverse causes is crucial to maintaining liver well-being. In this video, we'll uncover 12 peculiar signs that may be indicative of liver damage. Understanding these signals, whether subtle or strange, could be the key to early intervention and preventing irreversible harm. 1. Jaundice. Jaundice is a medical condition characterized by the yellowing of the skin, mucous membranes, and the whites of the eyes. This yellow discoloration occurs due to elevated levels of bilirubin in the blood, which is a yellow-orange pigment produced during the breakdown of red blood cells. The liver plays a crucial role in processing bilirubin. When red blood cells reach the end of their lifespan, they are broken down in the spleen and release hemoglobin. Hemoglobin is then converted into unconjugated bilirubin, which is transported to the liver. In the liver, bilirubin undergoes a process called conjugation, where it is transformed into a water-soluble form that can be excreted in bile. When bilirubin levels rise in the blood, it can deposit in various tissues, leading to the characteristic yellowing seen in jaundice. Additionally, bilirubin has neurotoxic effects, and high levels can result in symptoms, such as itching and cognitive disturbances. Jaundice itself is a symptom rather than a disease, and its presence often indicates an underlying issue with the liver or bile ducts that requires further medical investigation and treatment. If someone develops jaundice, it is important to seek. 2. Biliary colic. Right upper quadrant, RUQU. Abdominal pain and discomfort, often referred to as right side pressure or biliary colic, can indeed be indicative of underlying liver damage. To understand this association, it's crucial to delve into the anatomical and functional relationships between the liver and the biliary system. The liver plays a central role in various physiological processes, including the production of bile. Bile, a digestive fluid synthesized by the liver, is stored in the gallbladder and released into the small intestine to aid in the digestion and absorption of fats. The biliary system comprises the gallbladder, bile ducts, and associated structures that facilitate the transport of bile. Liver damage can manifest in several ways, impacting the normal functioning of the biliary system. One common cause is liver inflammation, which can result from conditions such as viral hepatitis, alcoholic liver disease, or non-alcoholic fatty liver disease. As the liver undergoes inflammation, the flow of bile may be compromised, This interruption in the regular flow can lead to the accumulation of bile in the gallbladder, causing distension and increased pressure within the biliary system. The heightened pressure in the biliary system can give rise to symptoms like right upper quadrant pressure or pain, commonly referred to as biliary colic. This discomfort may be intermittent and is often associated with meals, as the ingestion of food triggers the release of bile to aid in digestion. The compromised biliary flow, however, can result in inefficient digestion and absorption of fats, contributing to symptoms like bloating and discomfort after eating. Furthermore, liver damage may lead to the formation of gallstones, which can obstruct the bile ducts. These gallstones hinder the smooth flow of bile and can cause intense spasmodic pain in the right upper quadrant, characteristic of biliary colic. In severe cases, the obstruction may progress to complications such as cholecystitis or inflammation of the gallbladder. 3. Spider veins. Spider angiomas, also called spider nevi or vascular spiders, are skin issues that might signal problems with the liver. They look like a spider, with a red center and small blood vessels branching out like legs. Although spider angiomas can happen for various reasons, their connection to liver issues is important. When the liver isn't working well, it affects how blood flows in the body. Normally, the liver filters and processes blood, keeping things balanced. But in conditions like cirrhosis or hepatitis, the liver can't do this properly. This leads to changes in blood flow, causing more blood to go to the skin and creating spider angiomas. This happens because the small blood vessels expand, and new ones form in response to the liver not working as it should. Spider angiomas are also linked to high levels of estrogen, a hormone that the liver usually breaks down. When the liver is damaged, it can't break down estrogen properly, causing higher levels of this hormone. Elevated estrogen levels make blood vessels widen, contributing to spider angiomas. This hormonal aspect emphasizes the connection between liver problems and the development of these skin issues. In the medical field, seeing spider angiomas often makes doctors check the liver's health. While these skin problems can happen for other reasons, their presence, especially with other signs of liver disease, tells healthcare professionals to investigate further. Finding and dealing with liver issues early is crucial for better health and preventing more complications. 4. Dark urine. Dark urine can be a potential indicator of liver damage or dysfunction, although it is important to note that it is not a definitive diagnosis on its own. The color of urine is primarily influenced by the presence of a pigment called bilirubin, which is produced during the breakdown of red blood cells. In a healthy liver, bilirubin is processed and excreted in bile, a digestive fluid. However, when the liver is damaged or not functioning properly, it may struggle to process bilirubin efficiently. This can lead to an accumulation of bilirubin in the bloodstream, a condition known as hyperbilirubinemia. When excess bilirubin is filtered by the kidneys and excreted in urine, it can give the urine a dark or brownish color. If someone notices persistent dark urine, especially accompanied by other symptoms such as jaundice, yellowing of the skin and eyes, abdominal pain, fatigue, or unexplained weight loss, they should seek medical attention promptly. 5. Pale stools. Pale or clay-colored stools can be a sign of liver damage or dysfunction. The color of the stool is primarily due to the presence of bilirubin, a yellow-brown pigment that is produced when the liver breaks down old red blood cells. Normally, bilirubin is excreted in bile, which gives stool its characteristic brown color. Liver damage can disrupt the normal production and secretion of bile, leading to changes in stool color. When bile flow is obstructed or reduced, bilirubin may not be adequately delivered to the intestines, resulting in pale or clay-colored stools. 6. Swelling or fluid retention. Swelling or fluid retention, particularly in the form of ascites, abdominal fluid accumulation, or edema, Fluid retention in the legs is a notable manifestation of liver damage. The liver plays a crucial role in maintaining fluid balance within the body through the synthesis of proteins such as albumin and the regulation of blood flow. When the liver is compromised, its ability to perform these functions becomes impaired, leading to the accumulation of fluids in different areas. One key factor contributing to fluid retention in the abdomen is the decline in the synthesis of albumin, a protein produced by the liver. Albumin helps to maintain the osmotic pressure in the blood vessels, preventing the leakage of fluid into surrounding tissues. In cases of liver damage, the reduced production of albumin compromises this osmotic balance, allowing fluid to accumulate in the abdominal cavity, leading to the development of ascites. Additionally, liver damage can result in increased pressure within the veins that drain blood from the digestive organs, a condition known as portal hypertension. Portal hypertension can further contribute to the formation of ascites as the elevated pressure forces fluid out of blood vessels and into the abdominal space. Edema, or fluid retention in the legs, is another common consequence of liver damage. This occurs when the liver is unable to effectively regulate blood flow, leading to increased pressure in the veins. The elevated pressure can cause fluid to leak into the surrounding tissues, particularly in the lower extremities. Edema is often a result of compromised liver function and can be a visible indicator of underlying liver disease. In summary, swelling or fluid retention in the form of ascites or edema serves as a significant clinical sign of liver damage. The intricate roles of the liver in protein synthesis, fluid balance, and blood flow regulation are disrupted when the liver is compromised, ultimately leading to the accumulation of fluid in the abdominal cavity or legs. Monitoring and addressing these symptoms are crucial in diagnosing and managing liver diseases effectively. 7. Itchy skin. Itchy skin or pruritus can indeed be associated with liver damage, and this connection is often linked to a condition called cholestasis. The liver plays a crucial role in various metabolic processes, including the production of bile, a substance essential for digestion. When the liver is damaged, bile flow may become obstructed, leading to a buildup of bile acids in the bloodstream. In cases of liver damage, the impaired flow of bile can result in cholestasis, a condition characterized by the accumulation of bile salts and other substances in the skin. These substances can trigger irritation and inflammation, causing the skin to become intensely itchy. This itching is not limited to a specific area and may be widespread across the body. Furthermore, the presence of elevated levels of bile salts in the bloodstream can have direct effects on nerve endings in the skin, intensifying the sensation of itching. The severity of pruritus can vary, ranging from mild discomfort to a persistent and distressing symptom. It's important to note that while itchy skin can be a sign of liver damage, it is not exclusive to liver-related conditions and can also be associated with various other medical issues. 8. Poor night vision. Poor night vision can be linked to liver damage through its association with a deficiency in vitamin A. The liver plays a crucial role in the storage and conversion of vitamin A, which is essential for maintaining healthy vision. Vitamin A is a fat-soluble vitamin that is absorbed in the small intestine and transported to the liver for storage. When the liver is damaged, its ability to store and release vitamin A may be compromised, leading to a deficiency. Vitamin A is a key component in the synthesis of rhodopsin, a light-sensitive pigment found in the retina of the eye. Rhodopsin is particularly important for low light and night vision. In the absence of an adequate supply of vitamin A, the regeneration of rhodopsin is impaired, resulting in poor adaptation to low light conditions. This deficiency can manifest as difficulty seeing in dimly lit environments, reduced night vision, and an increased sensitivity to glare. Liver damage may also impact the absorption of dietary fats, including those necessary for the absorption of fat-soluble vitamins like vitamin A. If the liver's function is compromised, it can hinder the absorption of these essential nutrients, further contributing to a deficiency and subsequently affecting night vision. 9. Purple or red spots. Purple or red spots on the skin, also known as petechiae or purpura, can be indicative of liver damage, though it's important to note that they are not exclusive to liver-related issues. These spots result from the leakage of blood from capillaries beneath the skin, leading to the appearance of small, reddish, or purple pinpoint dots. Liver damage can contribute to this phenomenon through various mechanisms. One primary factor linking liver damage to the development of purple or red spots is a condition known as thrombocytopenia. The liver plays a crucial role in producing proteins necessary for blood clotting. When the liver is damaged, its ability to synthesize these clotting factors may be impaired. As a consequence, the blood's ability to clot properly is compromised, leading to an increased risk of bleeding. Thrombocytopenia refers to a reduced platelet count, and when platelets are insufficient, the blood vessels are more prone to leakage, resulting in the characteristic skin discoloration. Additionally, liver damage can lead to portal hypertension, a condition characterized by increased blood pressure in the portal vein that carries blood from the digestive organs to the liver. This elevated pressure can cause blood to bypass the liver, resulting in the accumulation of toxins and metabolic byproducts in the bloodstream. The compromised blood flow and increased pressure may contribute to the formation of petechiae by weakening the blood vessel walls and promoting leakage. Furthermore, conditions like cirrhosis, in which scar tissue replaces healthy liver tissue, frequently accompany liver damage. The presence of cirrhosis can disrupt the normal functioning of the liver, affecting blood flow and further exacerbating the risk of bleeding and petechia formation. 10. Easy bruising and bleeding. Easy bruising and bleeding can be indicative of liver damage, as the liver plays a crucial role in the body's clotting mechanism. The liver produces proteins known as clotting factors, which are essential for the blood to form clots and prevent excessive bleeding. One of these key clotting factors is fibrinogen, synthesized by the liver, which contributes to the formation of stable blood clots. When the liver is damaged, its ability to produce an adequate amount of clotting factors, including fibrinogen, is compromised. This can lead to a deficiency in these essential proteins, resulting in impaired blood clotting. As a consequence, individuals with liver damage may experience easy bruising and prolonged bleeding, even from minor injuries or trauma. Furthermore, the liver is responsible for breaking down and removing old or damaged blood cells from the circulation. In the case of liver dysfunction, this process may be impaired, leading to an accumulation of toxic byproducts in the blood. These substances can interfere with the normal functioning of platelets, the blood cells responsible for initial clot formation. Consequently, inadequate platelet function can contribute to a higher tendency for bleeding and bruising. In addition to the direct impact on clotting factors and platelet function, liver damage may also result in a decrease in the production of other essential proteins involved in maintaining blood vessel integrity. This can make blood vessels more susceptible to damage, further increasing the likelihood of bruising. In summary, easy bruising and bleeding serve as potential indicators of liver damage due to the liver's critical role in synthesizing clotting factors, maintaining platelet function, and producing proteins that contribute to blood vessel integrity. Monitoring these signs can be crucial for identifying liver dysfunction and seeking timely medical intervention to address the underlying causes. 11. Clubbed fingers. Clubbed fingers, also called digital clubbing, happen when the fingertips swell and widen. Abnormally, this condition is often linked to different health issues, and one major cause is liver damage. The changes in the fingers, like the nail bed and surrounding skin, lead to clubbing. Liver damage, especially in chronic liver diseases, can make clubbed fingers develop. The liver is vital for balancing substances in the blood. When it's not working well, the body undergoes certain changes. This includes shifts in protein and growth factor levels, contributing to clubbed fingers. Hepatic cirrhosis, a late stage of chronic liver disease, is often connected to clubbing. Cirrhosis involves extensive scarring in the liver, disrupting its normal function. This imbalance in factors regulating tissue growth, including in the fingers, causes swelling and clubbing. Liver damage can also affect blood flow and oxygen levels. Altered blood flow due to liver issues adds to the development of clubbed fingers. Low oxygen levels, known as hypoxia, may release substances that encourage tissue growth, leading to the unusual changes seen in clubbing. It's important to know that clubbed fingers aren't only linked to liver problems. Various other conditions, like respiratory and cardiovascular diseases, can also cause clubbing. 12. Vomiting blood. Throwing up blood, known as hematemesis, might signal various health problems. While it's not only linked to liver issues, liver damage can be a factor. The liver does important things like helping blood clot, making proteins, and detoxifying the body. When the liver is in trouble, it can lead to conditions causing vomiting blood. One common liver problem is cirrhosis, where the liver tissue gets scarred over time. This can create swollen blood vessels, varices, in the digestive system, especially the esophagus and stomach. If these vessels break, it causes internal bleeding. The blood mixes with stomach juices and comes out as vomit with blood. Liver damage often comes from things like long-term alcohol abuse or viral hepatitis, especially hepatitis C. Both can cause inflammation and scarring in the liver, making it more susceptible to bleeding problems and varices. In short, vomiting blood could mean liver trouble, especially with conditions like cirrhosis causing varices and clotting issues. If someone has this symptom, it's crucial to see a doctor right away for a diagnosis and proper care to tackle the underlying liver problems and prevent more issues. Being aware of 12 weird signs of liver damage is crucial for maintaining overall health. Early intervention not only aids in preventing further damage, but also enhances the chances of successful treatment. Have you experienced any of these signs? Let us know in comments down below.